Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and I'm very pleased to welcome my next guest, Dr. Scott Smith, podiatrist.
Correct.
Dr. Smith, thank you so much for coming on the program.
Thanks for having me.
Now, teach our audience exactly what a podiatrist is and what does a podiatrist do?
What a podiatrist is. Podiatrist is a specialist of foot and ankle medicine and surgery, so anything that has to do with the foot or the ankle. And what it is it's a profession just based on that. There's a 4-year program that we do for that, and then there's a certain amount of residency training. But it's a specialist just of the foot and the ankle.
Okay, so Dr. Smith, again, what I like to do is imagine a high school student is listening. I want to teach them how they get to be a podiatrist. So let's start with finishing high school.
Sure.
Right? So what type of student do you feel makes a good podiatrist? Are they good with their hands? Are they good with their eyes? Are they interested in science? Are they interested in, I guess, taking care of patients, right?
Yeah, I mean, I think that, you know, a lot of times people say, do you have a foot fetish? That's the weirdest question I always get. Actually, not at all. The most important thing, I think anybody that wants to get into podiatry is, yeah, you have an interest in medicine in general, and then an interest in the foot. And I was lucky enough, my dad was a podiatrist, so I kind of grew up with it. But I think anybody who's interested in medicine and any kind of sports medicine related thing would lend itself well to podiatry, or at least consider it.
So certainly, Dr. Smith, foot disorders are common, and when someone has foot pain or a foot problem or a foot disorder, it's really debilitating to them.
Yes.
So before we talk about bunions, which is one of the topics I want to address today, tell us what your average week is like. Do you operate every day? Do you operate sometimes? When do you see patients, et cetera?
We see patients Monday through Friday. So we typically see patients every day, and depending on how much surgery, how little surgery you do, I'm in the operating room about once a week. So there's a good kind of ratio between clinic and then also surgery, depending on how much training you had and depending on what your interests are. So it's basically, Monday through Friday. I'd say Monday, Tuesday, Wednesday, Thursday in the office, and then Friday, for example, you'd be in the operating room. But just depending on how busy of a surgical practice you have.
Okay, and before I go on,
Yeah.
I want to back up for a moment and again go over the training to become a podiatrist. So everybody finishes high school.
Correct.
And then...
So you finish high school, then you do 4 years of college. You get your BS in college.
So you've got to get a college degree.
College degree, correct.
Okay.
Yeah. And then there's 4 years of podiatry school.
4 years of podiatry school
and this is,
after college.
After college, correct. Yeah. And this is actually an interesting point because a lot of people come up and say, hey, you're a podiatrist. What happened? Did you just get tagged onto like the cosmetology school? People don't have no idea how much training a podiatrist does.
I understand.
So exactly, it's 4 years of podiatry school, and then after podiatry school, you go into residency. And that's when, there's almost subspecialties within podiatry. So depending on how much training you do, you can do anywhere from 1 to 3, sometimes even 4 years of residency.
Okay, so podiatry school is 4 years.
Correct.
And what's podiatry school like? Is it similar to medical school?
Yeah, good question. It's very similar to medical school. Usually the first 2 years of podiatry school, you're with the first 2 years of a medical school that the podiatry school is usually associated with or works with. And then the third and the fourth year is when you kind of branch out into more things related to foot and ankle medicine specifically.
Okay. So it sounds like a lot of podiatrists are interested in sports medicine and they enjoy working with athletes, et cetera.
Yeah, I mean, I think a big part of podiatry is sports medicine. There's also a lot of other branches. Some of the biggest branches or specialties within podiatry would be sports medicine would be one, diabetes is a big one, geriatrics. I mean, there's just all different types of stuff within podiatry because you don't actually, it's interesting because when somebody comes into your office, they might have a bunion, but they might also have gout or something else, so there's a lot of different things, both medical and related just to the foot and the ankle that's going on. So it's kind of
it's a broad field.
It's a broad field.
It's amazing to me. Now, Dr. Smith, what's the residency like for podiatry?
Residency, for the most part, has to do with your first year being an internship year. So mostly you spend time working with other specialties, general medicine, vascular surgery, general surgery. You do a lot of rotations that really don't have much to do with the foot or the ankle yet. And then your second and your third year is when you start specializing in foot and ankle. And like, for example, the residency that I did, After the internship year, the second year we basically got into like a 4-foot reconstruction, and then the second year was more rear foot. So you kind of build up.
I recall, Dr. Smith, when I was chief resident at USC,
Yeah.
I had a number of the podiatry residents on my service,
Yep.
and we'd scrub together in the operating room, and I was responsible for taking them through cases, and
Yeah.
they did histories and physicals and saw sick patients, et cetera. So we
Yeah.
just all pretty much worked together at the county. We used
Yeah.
to call it LA County Hospital.
Yeah.
Dr. Smith, you know, we don't have lots of time today, but I do want to address one common operation or one common condition, and that's bunions and bunionectomy.
Okay.
Now, can we talk about that for a few minutes?
Sure.
Let's explain what we mean by a bunion.
Okay. So a bunion, in its most simplest terms, a bunion is basically the bump that you see on the inside of your big toe. A lot of people will kind of say that they have corns or calluses there, and they'll point to their big toe, but it's a big bump on the inside of the big toe. And what it means is that two bones are separating from each other, causing a kind of a malalignment of the big toe joint and giving you this bump. And the bump is really the bunion.
Okay, so the bump on what we call the inside of the foot, or the tibial or the medial side of the foot,
Correct.
that's kind of the base of the great toe or the big toe.
That's right.
You can have all kinds of degrees of bunions, right? It can be very mild or it can be very severe.
Yes, you can have mild, you can have moderate, you can have severe. Basically, people will have pain, discomfort, redness, swelling on that inside portion of the big toe. A lot of people will walk around with it for a long time. And I think something that's important to think about it is there are things to do for it, both conservatively or non-surgically and surgically. And it's important to kind of recognize that, because a lot of people will minimize bunions. But if you think about it, if your knee looked like that, or your hip, if it was malaligned like that and it was causing pain or damage to the joint, you'd seek attention for it. So
Okay, so my audience and myself, everybody wants to know
Sure.
what's the cause of a disease or a condition or a problem. So do we know what causes a bunion or bunions?
yeah, well, a certain percentage can be caused, it's hereditary. A certain percentage is hereditary. There's a certain percentage of kids that will actually have bunions that look like adult bunions, but they're in children. For most of the people, it has to do with the architecture of your foot and biomechanics, so meaning kind of the way the bones and the joints are aligned and the pressure that goes through them by the way that you walk. A lot of people also think that shoes causes bunions. If you look at most of the studies, shoes don't actually cause the bunions, but if you have a bunion, a shoe could make the bunion worse.
Okay, well, if you see someone in the office
Yeah.
who comes in and they have a bunion and they point to the bump at the base of their small toe, or sorry, great toe,
Yeah.
and they start to complain of some pain. Now, is there something you can do to prevent it from getting worse? Do you tell them to change their shoes? Do they immediately go to the operating room? Like, what's the story on the treatment of the bunion?
Good question. Here's the story. So patient comes in and they point to their big toe. The first thing to do is to classify how big it is, and usually we take an x-ray or a film to kind of to show us how big or small the bunion angle is. There's one important angle called the intermetatarsal angle that is good to get because you can track if it's mild, moderate, or severe. So that's one way. The second way is to actually move the toe up and down and see how much the joint hurts. So it's both the increase in the angle and how the joint actually feels that kind of puts you into a conservative or surgical category.
Okay, so how do you conservatively treat a bunion?
So say a person has a small angle and it's not hurting that bad and there's not much joint damage. Really the only things due to treat it conservatively would be change your shoes, wear an orthotic or an arch support, which there's a whole variety of that you can get, the best one being a custom fit orthotic for your foot specifically. And that's about it. A lot of people think that there's these straps you can buy. There's something called yoga toes. There's all different types of straps and pulley systems. None of them work when you take off the system.
Okay.
So it's dynamic.
Now, sometimes in the lay press and the popular press, we'll hear about an operation to prevent the bunion from getting worse.
Right.
Is that something commonly performed, or do you advocate that approach?
That's a good question. Here's the deal with surgery for bunions. Once you classify how big or how small it is, it's not so much a preventative surgery, but when you reach a certain angle, it puts you into a different category of a surgical procedure. They basically come down to two. One is easy for the patient to heal compared to the other. One of them is a procedure that's done in a certain location of the bone that allows you to walk after the surgery. So it's a weight-bearing procedure. The other one, you have to let the bone heal by being in a cast for about 3 months. So it's not so much preventative, but if you can do a procedure and reconstruct the toe earlier, it can prevent you from having to get that other procedure where you have to stay off your foot for a long period of time. And that has to do with the angle, how big it is.
Okay, so it sounds like when someone comes in and they point to this bump at the base of their great toe, where it meets the foot, you take a history,
Correct.
you do a physical exam,
Correct.
you get an x-ray,
Yes.
and then you talk about ways to prevent it from getting worse,
Yep.
or what is an indication for surgery.
Correct.
So, Dr. Smith, in your practice, what is the indication for surgery? When do you recommend that a person has an operation, and when do you recommend that it be treated conservatively?
I would say that people that are more considerations for conservative care would be people that may have other existing conditions where they can't get surgery or where the risk is greater than, what the outcome would be potentially as a benefit. Also people that just don't have an interest. There's a lot of people that just don't have an interest in getting surgery. There's things that we can do for them too, like we talked about the orthotics and the shoes. However, the surgical patient is one that's not only having pain on the bump, but also in the joint, because it's important to understand that not only is it a bump, but actually you can damage or get arthritis in that big toe joint. So if you're having any kind of joint pain, if you're having any kind of pain when you're in shoes, and you're not willing to just wear Birkenstocks, a lot of people that come in wear very nice shoes. And so if I say, we'll get a New Balance and get, an orthotic, that's basically the equivalent of them, it's like them getting wearing ski boots to work or something. They just won't do it.
Right.
So, a surgical candidate would be someone who's having symptoms, but also someone who, if the bunion continues to get bigger, it can lead to more joint damage, and therefore you might have to go to other types of procedures down the road.
Okay. Now, Dr. Smith, you also mentioned gout, which can also cause a problem in that joint, right?
Correct.
And may actually cause a bump.
Right.
And you mentioned diabetics can have problems with their feet. Now, not necessarily do bunions and gout and diabetes go together. However, they can coexist. Isn't that correct?
Absolutely. Yeah.
So in your practice, how do you distinguish between pain and bump from gout and pain and bump from, say, a routine bunion, or a typical bunion, if there's such a thing?
Sure. No, it's a good question. Typically, gout will present as a very hot, red, swollen big toe, and it's an acute event. So somebody will wake up in the middle of the night. Usually they've had, a lot of wine and a steak the night before. Sometimes that happens. They'll wake up, a lot of pain, they'll come in, and sometimes it'll usually be on the big toe. It can be in other places, but some people will think that's a bunion, and it's actually gout, and sometimes they kind of can overlap. Diabetics can also have bunions just as well, which even makes it more important to take a look at, because that bump can also cause an ulcer, and that is sometimes avoided by correcting the bunion as well. So those are two different conditions that kind of do affect the big toe quite a bit.
Okay, now, so what's the purpose of getting an x-ray? And again, one of the terms I try to teach my audience about is this term that doctors use called the workup.
Sure.
And a workup means we investigate it, right?
Right.
We want to investigate what's the cause of the bump and why is someone feeling discomfort or pain.
Right.
So you get an x-ray, and now can you also get an idea of what's going on by physical exam before you get an x-ray, and the symptoms that they present with? How are they different?
Usually the symptoms will generally be somewhat similar. As far as big toe joint pain, usually there'll be a little bit of redness on the bunion bump. They'll point to the shoe where it hurts. And at that point, you do both physical exam and take an x-ray. As far as the physical exam, we're actually, feeling the foot. Oftentimes there'll be pain when you move the toe up and when you move the toe down. Sometimes there'll be some crunching or crepitus in there that'll cause pain. And then also you'll look at the skin. Sometimes there's ulcers or pre-ulcers or calluses and corns in that area as well. But the film is really important because it allows you to classify how big or small the bunion is. And by classifying that, you're able to kind of direct the treatment for that patient. Every foot is very different. And there's a lot of different factors that go into picking the right procedure for the patient. There's over about 150 bunion procedures described in the literature, and really they come down to about 2 that are the most widely done, at least here in the United States.
There are 2 common procedures for bunions,
Correct.
And are they both called bunionectomy or not?
Yeah, all of them are kind of labeled bunionectomy, but a lot of people have, when you say bunionectomy, a lot of people that come in think that you just kind of shave the bump off. That's pretty much what everybody says. You're just going to kind of shave the bump off, right? And that's actually for a very small percentage of people. Most of the time, we actually reconstruct the big toe and what's called the first metatarsal through reconstructive surgery. So we actually are moving something over and putting it in a proper position and thereby aligning the joint, because that's the most important thing, is to align the joint, thereby preventing arthritis down the road.
Okay, now, Dr. Smith, you mentioned arthritis. Now, I do a fair amount of hand surgery,
Sure.
and I sometimes replace joints. I replace the knuckles or the base of the thumb, and sometimes I fuse them. Do you do that same thing for the great toe joint? Is it called the metatarsal phalangeal joint?
Correct, yeah.
Now, do you sometimes fuse that joint or replace the joint or do an arthroplasty?
Another great question. Yes, to answer your question, yes. Oftentimes, now what we do is usually implants or implant arthroplasties. Both are done, fusions and implants. Most of the people in my practice seem to like and want the implant more than the fusion because of range of motion. But yeah, both of those are for end-stage arthritis in the big toe joint. And certainly, you know, we do those too. Now that's something that we like to try to avoid. And so when you mentioned earlier about preventative surgery for bunions, that would be a reason for repairing a bunion so you don't have to end up getting that.
Okay, so it sounds to me like treatment of the foot, especially just that one little joint right there, can be incredibly complicated.
Yeah.
And I'm starting to understand why you guys do 4 years of podiatry school and then residency after that, et cetera.
Yeah.
So let's kind of summarize the two operations for bunions called bunionectomy, and kind of summarize how long it takes and what the postoperative care is like, and do they have to get a general anesthetic, or is it a local, et cetera? Is it done in the office or hospital or outpatient? Give me a summary of what it's like.
Okay, so I would first of all say that I would say about 80 to 85% of people would fall under a category of getting what's called an Austin bunionectomy, or a distal metatarsal bunionectomy. And what that typically entails is that the procedure takes about 45 minutes to an hour. You are basically with crutches and taking it easy for a weekend. And then the most important thing with that procedure, if you can get that one done, is that you're able to wear a shoe or a ski boot. It's either a postoperative shoe or it looks like a ski boot. And you're in that for 1 month. So the first thing to remember is that if you take the average, about 4 weeks of partial weight bearing in the boot is what happens with that procedure. And that's why it's so nice to get that one done. Yes, it's done either in a surgery center or in the outpatient surgery center at the hospital. You don't have to have general anesthetic for the Austin bunionectomy. Usually we can do that with local and monitored anesthesia. As far as pain goes, it's not painful because we give you medicine before, during, and after. A lot of people come to me and they say, well, my grandma's best friend's sister had it done and it was so painful she lost her arm. I mean, there's just these incredible stories out there. And it's really not true. It's actually done very consistently now.
Well, great. Dr. Smith, you know, we're unfortunately coming to a close. I want to make sure that we give out either your phone number or a website. And where's your office again?
Office is in Ryan Ranch at the Community Outpatient Campus, Upper Ragsdale. Okay,
Dr. Scott Smith, podiatrist.
Correct.
And do you have a phone number or website we can give out?
Website is MontereyFootDoctor.com.
MontereyFootDoctor.com.
Phone number is 649-3338. And the name of the practice is Smith Foot and Ankle Center. And it's both myself and my dad also, who's Alan Smith.
Family tradition.
Family tradition.
I think that's great. Dr. Scott Smith, podiatrist, right here at Ryan Ranch, 649-3338.
Yes.
Dr. Smith, thank you so much for coming on the program. I hope you come on again because we're just getting into this fascinating stuff all about the foot.
Anytime. Yeah, thank you.
I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. We're coming right back after a very brief pause for a very good cause. Thanks for being here.